Hello, my name is Shaughnessy, and this is my podcast called Samples of Science Cuisine, and I would like to introduce today's guest.
My name is Brett Rice.
And then what's your job? What's your title?
I'm the director of the Human Performance Lab, which is part of in the school of, not in the school, but in the Department of Exercise Physiology. I also am an adjunct professor. I teach one class in the exercise physiology program.
What's that class that you teach?
Medical terminology.
Okay.
It's a first-year class. It's always for freshmen, first-year freshmen.
Yeah.
And sometimes other students take it if they had to drop it or they didn't pass it.
Yeah.
But usually it's for first-year freshmen.
Okay. When you say that you're director of the Human Performance Lab, can you go into a little bit more of what that entails?
Sure. So the Human Performance Lab is a teaching lab. So its main purpose is to have a place for our students to be able to practice their craft, be able to do what they've learned in their classes. But we also work with the community, so we have people from the community come and work out with us and exercise with us. So I oversee all of that. I have 5 graduate assistants that report to me, and then we have a whole bunch of interns, undergraduate ex-phys interns.
Okay.
Yeah. So I oversee that whole operation.
Okay. So participants just come in and exercise here, essentially?
Yes. We work with all full spectrum of different types of clients. A lot of the clients that we have are kind of what we call more special population, where they are come from cardiac rehab,
Okay.
or they are referred to us from physical therapy. We do work with just general healthy people that just are here just for prevention and want to work out. But we do have a lot of clients that have underlying health conditions, and they work out. It's a safer place for them to work out versus just going to
A gym,
maybe Planet Fitness or something.
Yeah. Can you describe exercise physiology to me as a whole, just the general concepts of it?
Yeah. I mean, basically, exercise physiology is the study of the body's response to exercise. At the end of the day, that's kind of what it's all about. So the program has undergrad, master's, and also PhD level students.
Okay.
But at the end of the day, that's pretty much, it's that simple. It's a study of how the body responds to exercise.
So what kind of careers can students go into with an undergraduate degree or any of the levels of degrees in exercises?
A lot. There's a lot of options. The exercise physiology program is actually one of the largest degree programs in the whole university.
Oh, wow.
Particularly the undergrad.
Mm-hmm.
And the reason for that is that it allows students to get the prerequisites they need to go into so many different tracks. Mm-hmm. So I have current interns and former interns, as an example, that have gone into anything from PA school to master's exercise physiology, physical therapy school, occupational therapy. I mean, it's just a whole dental school.
Wow.
Med school. I mean, as a whole, the program allows them to get all the prerequisites that are needed. So a lot of students use the degree as a stepping stone to, other health careers.
Yeah. Because a lot of the prerequisites are in the degree program?
Correct.
Okay. So switching gears a little bit and focusing on you, did you always know that you wanted to go into exercise phys? Like in college, what did you major in? Did you switch your major at any point?
Yeah, no, I graduate. I'm a graduate of this program,
Okay.
undergrad anyway, and I always knew that was what I was interested in doing.
Yeah.
So I didn't go to the master's level here.
Okay.
I did something else. I did community health.
Okay.
But yeah, it's something I've always have been interested in and knew I wanted to do for sure.
Yeah. I feel like community health would go really well with this because
Yes.
it's focusing on the community.
Correct.
That's very interesting. So What is a commonly held belief about exercise physiology or your role in exercise physiology that you passionately disagree with? You can take a second to think about it.
I think the big thing that a big misconception that a lot of students have is that it's going to be easy.
Yeah.
They think, oh, and they don't really know what they want to do. So they just, like a lot of students, it's very common to not really know for sure what direction you want to take your career or what you want to study. So
Yeah.
the exercise physiology, I feel a lot of times is appealing to a lot of students because they think, well, I like to exercise. That sounds good. But they get into the program and they realize that this isn't the school of medicine. I mean, this isn't.
Yeah.
This isn't.
It's not easy.
It's not easy. It's not easy. Yeah.
Yeah, I had no idea what exercise physiology was before I read the web page on it before coming to the interview, and I was like, oh, this is actually really interesting. So what does a typical day look like for you in your role?
Typical day for me is I usually get into work any time between 8 to 9 a.m. The lab opens at 8 a.m. We have other professors in the XPhys that also work in the lab, so we have we adjust our schedules from one day to the next to have the lab covered. Most of it is just obviously I'm in charge of all the behind the scenes day-to-day stuff, the business stuff that I have to take care of, but a lot of dealing with schedules, with graduate assistant schedules, intern schedules, making sure everybody's where they're supposed to be. And then after that, it's mainly just dealing with the day-to-day business of it all. The lab is very busy. We have, any given day, there's a lot going on. So just dealing with the day-to-day interaction with clients, working with clients. That's a pretty typical day.
Yeah. This totally blanked on what I was gonna say, but if you could go back and give your college self a piece of advice, what would you say?
That's a good question. Well, I definitely don't regret what I chose for my degree selection. I mean, I'm glad I studied what I did. I guess if anything, I might say study harder. I mean, I didn't have any problems, passing classes and that kind of thing. But I probably wish I would have had a little bit of better grades, I guess, when I was looking at what I wanted to do particularly after undergrad. Where I might have had a B or a few C's, I wish it would have been an A. But that is what it is.
Yeah.
So
it didn't hinder you for getting where you wanted to be.
No, it didn't.
So that's always good. What is, and you can focus on any aspect that you want to, but what has been your biggest failure in your entire educational career?
Educational career?
Educational career or general career?
Yeah. Biggest failure. I guess I don't know, you stumped me on that one.
Yeah, it's a hard question.
That's always a hard one, isn't it? Yeah. It's like, what are your strengths and weaknesses, right?
Yeah.
That's a common
question. Well, the follow-up question to this is, what's your biggest success? So you can do either one first.
I mean, as far as my career goes, biggest success, I guess, would be the fact that I am where I'm at now. I mean, it's, I was fortunate to be in this position. And so, I mean, that's definitely... I'm definitely proud of that. As far as the biggest regret I have, gosh, I don't know.
It's a hard question.
I'm sure one will come to me here in a minute.
We can come back to that question. So you see a lot of college students, you see a lot of first-year freshman college students.
Mm-hmm.
So what is an admirable characteristic that you see in college students? What is the most admirable that you see?
Admirable that I see.
Yeah.
And most of them, I'm always been very impressed. Like I said, this program isn't for the faint of heart. I mean, it's not easy. So I'm pretty impressed with the work ethic of most students.
Mm-hmm.
I mean, it's a lot. It's a lot.
Yeah.
Even like the medical terminology class that I oversee, for lack of a better term, that class is kind of used as a weed out class for exercise physiology, because it does require, it's not a hard class, but it's one of those types of classes where it just requires a lot of hard work and studying.
Yeah.
It's one of those classes where you either know it or you don't type of class. Yeah. And if you don't put the time in and study, then you're not going to do well in the class. Yeah. It's just impossible. If you just consider yourself just naturally smart, it's not going to do you any good in a class like medical terminology, because you've got to study the material and learn the terms and things like that. So most of the students that I see, doing a fantastic job in that class, but the ones that don't do well or fail, I mean, it's just because they're not putting the time and effort in.
Yeah. So what's a piece of advice that you would give to exercise physiology students, or just students in general?
Mm-hmm. Choose the degree for the right reasons. Like say, as I mentioned earlier, don't choose exercise physiology because you like to exercise. Yeah. There needs to be more thought put into it than that, because you're going to have to realize that this is a degree in school of medicine. It's got challenging courses, and like I say, if you're not planning to work in that health profession as a long-term goal, then it doesn't really make much sense to get your degree in exercise physiology.
Yeah. Can you go into a little bit more of like the post-undergraduate degrees, like the master's degree and the PhD degree with this program?
Yeah. So again, the other undergrad, very popular, one of the biggest programs in all of WU. Most students go on and to other health professional level health type of things, like I mentioned, all the different dental school, all that. Yeah. The master's program is they have a couple different tracks. They have what they call clinical track, which most of most of my graduate assistants, they're in the clinical track. Well, that's working. A lot of those students go on and work in cardiac rehab and other settings like that. There also is a new tactical track with the master's program, which what that is those students are studying to work with the tactical population in like a strength conditioning type of setting. Okay. So that's firemen, police, military. Okay. It's kind of an up and coming thing. Is to treat our first responders kind of like how we treat athletes. Yeah. So that's actually something that Dr. Brian Leary, he just recently started that program. The first group of students started this fall. So it's a new thing that they're
interesting.
Doing. Yep.
That's very interesting. Yep.
As far as the PhD side, most of that is just research.
Okay.
Research based.
What kind of research fields are there?
Yeah, I mean, basically studying, the effects of exercise. Okay. I can't speak to it, and I don't know what a lot of the professors are working on right now, but I know it's definitely going to be related to exercise.
Yeah. I know somebody who was going to do a PhD in exercise, and they were going into, I can't remember if it was something with the skeletal muscles or something like that, and it was something that they produced. I can't exactly remember, but it related to some type of cardio exercise. And we went through this fast. What's one question? Oh, did you think about the biggest failure or biggest regret that you have? It's a hard question.
Yeah, no, I think I have an answer. When I say it, it is kind of a regret, but it isn't, because I'm kind of one of these people that no regrets, right?
Yeah.
You know, I'm not. But when I was in getting my master's, I was a graduate assistant strength and conditioning coach,
Okay.
and I worked with all different athletes here on campus, football, basketball. I mean, I worked with a lot of the women's sports even, and so at that time was thinking that's what direction I wanted to go with my life. In the profession, I wanted to do strength conditioning.
Yeah.
And working with athletes. And after I graduated, I kind of was like a lot of people. I stood at a fork in the road.
Yeah.
And I said, what direction do I want to go with this? Because during my master's program, I had got exposed to the world of corporate wellness.
Mm-hmm.
And I did an internship in corporate wellness, and I really liked it. And so I kind of had to make a decision about, well, what direction do I want to go? And there are some times over the years where I've kind of thought, well, wow, I wish maybe I would have done the whole strength conditioning thing and tried to be a strength conditioning coach. But I say there's upsides and downsides of that too.
Yeah.
It's an exciting profession, but it also, you have to work in crazy hours.
Yeah.
With that profession.
Definitely.
So I guess if there was anything, that'd probably be it. Maybe sometimes I regret the decision I made, but I try not to.
Yeah, because you got to focus on what you're doing now.
Yeah.
Does the exercise physiology field relate a lot to physical therapy and occupational therapy?
Yeah, definitely. I mean, I'd say a lot of our undergrads go on to physical therapy and occupational therapy school. Mm-hmm. And here in the lab, we get referrals from physical therapy. So if they have a patient that they've worked with and they've got them to, for whatever reason they were seeing physical therapy or occupational therapy, once they, saw them and got them to a certain level and their visits they didn't basically have any more visits that they could bill to insurance, then they refer them to us to continue on what they had been doing. So the two definitely mesh a lot.
And then you went into like the fields of exercise physiology, like the tactical and the clinical. Mm-hmm. What are some places that exercise physiologists can work? Yeah. Like, I've heard of them working in like hospitals.
Correct. Yeah. So definitely can work in a cardiac rehab type of setting. Okay. And most hospitals have a cardiac rehab program. So definitely that's one of them. You can definitely work in just a general fitness setting. Usually to do that, you would definitely need to become like a certified personal trainer.
Yeah.
Of some sort. That's one thing about exercise physiology is unlike other professions like physical therapy or occupational therapy or whatever, they have a national licensure exam that you have to pass to say, your stuff. Yeah. You're a licensed physical therapist or occupational therapist. But exercise physiology doesn't have a national licensure exam. So what ends up happening is that there are these accredited certifications that are out there through organizations like National Strength Conditioning Association or American College of Sports Medicine, that you take those exams and then become, like, if you wanted to work in a fitness setting, certified strength conditioning specialist is what I am, or certified personal trainer. It's called different things depending on the certifying agency. And again, of course, so you have your basic, general fitness. You have strength and conditioning, which I almost went into, working with athletes. And you have tactical, like we say, which is strength conditioning with first responders. Yeah. So those are the probably most common.
That's really interesting.
Yeah.
We went through all my questions really fast. So what is one question or one topic throughout this conversation that you wish I would have asked you, and then how would you have answered to it? Like a topic that you wish we would have covered?
Yeah. That's a good question.
I have some good questions.
Well, I guess I could tell you a little bit more about the lab and some of the tests and things that we do here.
Yeah.
So as I mentioned, we get a lot of referrals here from physical therapy, occupational therapy, just even physicians that have a client that they want to help. They want to see them lose weight or become more fit. Some of the most referrals we get is from the W Medicine Medical Weight Management program, which they work exclusively with people trying to lose weight. And so we do a lot of testing and get a lot of referrals from them. The testing that we do there's two main tests that the doctors over there want their clients to get, because it helps them set up their weight loss program and plan for them.
Okay.
We are one of the only places, as far as I know, the only place in the state of West Virginia, or even the surrounding general area, that has a bod pod, it's a body composition assessment. It's highly accurate way of doing body composition.
Okay.
And so a lot of the doctors want to see, when they get a weight loss client, they want to know what am I working with here?
Yeah.
What is this person's body composition? What percent of them is fat mass? What percent of them is lean mass?
Okay.
And so it's nice to have a baseline number, so that way, once the person progresses through their program, they have them redo the test, and they can see the progress that they made with changing their body composition.
That's really interesting.
Yeah. The other thing we do is what's called an RMR, which is a resting metabolic rate test.
Okay.
And basically what that is you have a person, they lie down, it's at rest, and we hook them up to our metabolic cart. And basically what the metabolic cart is it measures oxygen consumption of a person. So the general premise is that the higher our metabolism is, the more oxygen our body uses, whether either at rest or with activity. So we use the metabolic cart, and we hook them up, and we get a very detailed reading of what that person's baseline caloric needs are. So that's the resting metabolic rate. So basically, we give the doctors a very detailed number of that person's baseline. So that baseline is defined as how many calories they would burn in a day if they just laid in bed for 24 hours and never moved.
Okay.
So not considering any movement that we do, how many calories does your body use just to live, just to function, to breathe, and your heart to beat?
How long does that test last?
It lasts about 15 to 20 minutes.
Okay.
And say they just have to lay there, and we hook them up to the mask, and basically it measures how much oxygen they use, and then we, through the software that comes with the metabolic cart, we give a detailed analysis of their baseline caloric needs.
Yeah.
So like I say, the doctors, it's very helpful for them, because they can see what they're not just estimating it. You can estimate those types of things, but many times they're not real accurate.
Yeah.
So they use that information to help set up the weight loss plan for their clients.
That's really interesting. Do you go in so you do those tests, and then do you just do cardio exercise here, or do you also do weights?
No, we do it all. We have strength training. We have weight equipment, free weights, and strength training equipment, and we also have cardiovascular equipment.
Okay.
And we do it all. Okay. We also do graded exercise tests, which is basically just using the same machine as when we do the resting metabolic rate test. It's our metabolic cart, and we have the person exercise on Usually we do it on a treadmill, but it can also be done on a bike as well. And we measure how much oxygen your body uses during the exercise test, and that allows us to estimate their what we call VO2 max, which is basically a measurement of how their cardiovascular fitness level.
I feel like that is something that you typically see with exercise. Like if you Google pictures of exercise phys, it's always somebody standing next to somebody on a treadmill with a mask.
Correct. And that's what they're doing.
Yeah.
They're doing a graded exercise test. Yeah, that's always good, I guess good for the camera. It looks interesting, but so.
But there is so much more in this field, as you've described, than just standing next to somebody on a treadmill with a mask on. So that's all the questions I have for today. To kind of wrap this up as my last question, the name of my podcast is called Samples of Science Cuisine. So it's like kind of like a quippy way to say that I'm going into a bunch of like STEM and science majors to give high school students the ability to access them sooner, so they make sure they choose the right fit for them. So it's kind of like a little bit of a positive quippy ending. What's your favorite type of cuisine?
My favorite type of cuisine. I like to eat, so that's a hard question. I guess if I had to pick any type of cuisine, I think I have to say probably Mexican.
Mexican?
Yeah. If there was anything, I don't know, I love Mexican food.
Mexican is good.
Yeah.
Well, that's all I have for today, so thank you for talking with me.
Of course. Thank you.